Hi, I'm Brenda Power Ahmad, and you are watching OTV, where we provide you with solutions for living. On this episode, we're going to provide education about extended health benefit plans and how you may be able to get funding for occupational therapy services for yourself and your family. At one time, physical health seemed to be the most important determining factor of a person's health and wellness. Therefore, many extended health benefit plans include coverage for chiropractors, registered massage therapists, and physiotherapists. All of these regulated specialists are very valuable and necessary to address many health symptoms and issues. However, as medical and rehabilitative sciences have grown, we now know that physical health alone does not determine overall health. Most extended health benefit plans have expanded to include psychologists and naturopaths to try and cover some of these service gaps, but still people are not receiving all of the benefit they could be if they had access to OT, and many companies are not selecting packages that include OT for their employees. Some people are paying into extended benefit packages that they hardly use because the services offered are not the right fit for them. We feel that this may be related to a lack of knowledge about the regulated OT profession. Occupational therapists have been part of the Regulated Health Professionals Act since 1991, the same duration as chiropractors, massage therapists, physiotherapists, pharmacists, optometrists, and other professionals often included on standard extended benefit plans. Insurance companies cover services that fall within the scope of OT practice, and yet OTs are not included in many plans to provide these services. Even when an OT would be the best profession for a client with any given issue, many people do not have the option of accessing an OT even though they pay into their benefit plan. For example, a person who fell and hit their head may not need physical rehabilitation, massage, or a chiropractor. But now they can't stay on the same train of thought, they become angry over little things, and they can't remember how to do the things they used to do. This person may not be able to return to work or complete necessary life demands, like taking care of themselves or their children. Acquired brain injury has become known as the silent epidemic. Every day in Ontario, approximately 35 people are admitted to hospital that have symptoms just like our case scenario. If OT coverage was included in their health benefit plan, an OT would be able to provide rehabilitation that they otherwise could not afford. This is an unfortunate example, but it's one that OTs see often. Access to a private OT is also commonly sought by workers with children with autism or developmental issues, and this access is often not possible due to lack of extended healthcare coverage. Not every person is a suitable OT referral, just like not every person is a suitable physiotherapy, massage therapy, or chiropractor referral. Therefore, extended health benefit plans should offer more holistic, balanced options by including OT. After all, if you have an extended health benefit plan through work, you are paying into it whether you use it or not. The profession of occupational therapy is holistic, comprehensive, and addresses the many challenges children, adults, and seniors face throughout the lifespan. Through direct therapy, education, devices, and consultation, occupational therapy helps people to better manage physically, emotionally, cognitively, and behaviorally while completing tasks at home, work, school, or in the community. So, if OT is so helpful, why is it not included on most benefit plans? It's time to help people have access to OT. The Canadian Association of Occupational Therapists has compiled a useful resource on how to ask for occupational therapy to be included in your extended health benefit plan. They have drafted sample letters you can send to your HR administrator, university presidents, or insurance company providers to advocate for your right to access OT services using the same funds you are already paying into your extended health benefit plan. Check out the link on your screen for more information from CAOT about including OT in your extended health benefit plan. You can also sign our petition to have OT included in extended health benefit plans by going to this link. In the end, remember that each person, each disability, and each environment often needs a unique solution to any given problem. Seek the services of an occupational therapist if you have a functional problem to solve. That's it for this episode of OTV. Thanks for watching, and remember, OTs know stuff.